I'm going to be your nurse today for this procedure. The doctor ordered a Foley urinary catheter insertion, and I checked the order before entering the room. So can I please get your name and your date of birth? Okay. And do you have any allergies? Are you specifically allergic to iodine, betadine, shellfish, or latex? No? Okay. The reason we're asking is because in this procedure we're going to use betadine and iodine. So now I'm going to get the bed up to working height, and for this procedure, if you're a male, I'm going to have you in supine position, and if you're a female, I would have you in dorsal recumbent position. So now I'm going to get the blankets back, and I'm going to start preparing for perineal care. I'm going to provide hand hygiene before I do this. So basically what a Foley catheter is, it's going to be tubing that goes through your urethra into your bladder, and it's going to help relieve some of that urinary distension that you've had, and you're going to be able to urinate properly. So I'm going to place this towel on top of you in case we have any water that gets on top of you. And so for perineal care, all we're going to do is have warm water and soap, and we're going to take this washcloth, and for a female, I would go labia majora, different corner, labia minora, and then I would go down the meatus. And for a male, I would go in a circular motion around the meatus, down the shaft, toward the pubic region. And for a female, I would make sure to go front to back. And the purpose of perineal care is to prevent from any infections happening while we do the procedure. So after perineal care, I would remove my gloves and dispose them, but we're not going to dispose of them. We're going to reuse them because this is practice. And I would start getting my kit out. I make sure the table is close to me, so while we do sterile gloves, it's not breaking sterile field. But anyway, I would remove this, and I would put this bag over here for a trash bag. I'd make sure and open this up carefully, away from me, out and this way. And I'd be really careful to try not break sterile field. Put this piece underneath the patient, and I would put this over the patient. You can put that completely over it, but just for practicing purposes, so you don't have to rip it, we're just going to put it right there. Bring my sterile gloves right here. Be really careful not to touch anything but the outer edges. And I wouldn't reach over it like that. That would break sterile field. I did that. Just my sterile gloves on. Set this over here, and just go ahead and start preparing things in the right location. I would make sure and not move any of my objects outside of my sterile field. I would put it down right there. Make sure and have 3 cotton balls set out. I would pour the betadine in there, and I would dip it, and I would do labia majora, dispose. I wouldn't touch it in the trash can. Wouldn't actually touch the cotton ball in the trash can. Labia minora. That would break sterile field, but I'm just going to put it in there. It's okay. and I'm going to do the meatus. And if it was a male, I would just do 3 as well, and just do circular motion towards down the bottom of the shaft. So now I'm going to lubricate. For a female, I'm just going to put it in the pan, and I would dip the lubrication in there. For a male, I would insert the lubrication into the urethra. And I'm going to go ahead and put this inside the port, my saline inside the port, just to help with maneuvering whenever it's time. But I'm going to instruct the patient, tell the patient that it shouldn't be very painful, shouldn't be painful at all, but if it should be a little discomforting, but if there's any pain, let me know, we can stop. So after lubricating, I would just insert it slowly. For a female, it would only go in 2 to 3 inches. And you want to put it in forcefully. And for a male, it would go in, it should go in all the way to this Y part where it divides. And then after it's in 2 or 3 inches, I would make sure it's held securely at all times with this hand. I accidentally moved my hand away, but I wouldn't do that. I'd hold it. And then with my dominant hand, I would fill up the balloon. And then I would move it, and I'd slightly just pull, make sure that, not pulling it, but just make sure it's secure. Okay, and before doing any of that, I forgot to say, I would check for, make sure it's in the right spots. In the bladder, I would check for residual. And I would make sure to hang the bag on the bedside, not bedside, but below the bladder. Put it right there. I wouldn't hang it on the bed rails. And to check if I wanted a urine specimen, I would grab this, and I could grade it from the port, which would be more sterile, or I could get it from the bag, which would be less sterile. And I would tape it to the thigh if it was a female, and I would tape it to the abdomen if it was a male. So tape it, we're going to pretend I'm taping this to the thigh of the female patient. I'm going to start cleaning up. And I would also make sure that my patient is dry, wipe any extra betadine off. You don't want any skin rubbing together and getting infected or anything like that, so just make sure the betadine is wiped off. Put everything right in here. Fold this up. Here, dispose of my trash bag and my sterile gloves. I would wad that up in my fist and take them off. And I would make sure my patient isn't in any pain or discomfort. Put this back down. I would lower the bed back down to working height, lock it, and I would document everything that I did, and that should be it for insertion. So say 2 to 3 days later, the doctor ordered for it to be removed. So, hi, my name is Elena. I'm going to be your nurse today for the urinary catheter removal. Can I have your name, your date of birth? Okay, any allergies? No? Okay, great. Raise the bed back up to working height. So today, the doctor ordered a urinary catheter removal, so your bladder is functioning better, properly, so proper. I would provide hand hygiene again. Put my gloves on. I would use a clean pair of gloves, but it's just practice, so we're using them. I would place this up here in case any messes or spills. I have my syringe syringe, a clean sterile syringe. I wouldn't dig through an old packet, but I'd have my clean sterile syringe ready. I tell the patient that this is not going to be as difficult as putting it in, so I would just instruct the patient. First I would have to deflate the bladder, the balloon. I would put this in here and slowly deflate my balloon. Okay, I'd ask the patient to take a deep breath. I would gently pull it out. And before I would do that, I would empty the bladder, the bag. I would, since it's mannequin, it's not going to have any urine in it, but I would empty it, wrap everything up neatly. Over here, I would make sure the patient isn't in any discomfort, make sure they're comfortable. Lower the bed back. I would document that I did everything, and I think that's it.